All right, our next segment today, we're going to talk about roads to specialization, post-professional pathways, and the rise of clinical specialists in athletic training. And this was a really great talk, very insightful, given to us by Chris Servian and Dan Dobrowolski. Chris and Dan both are involved with the St. Luke's University Health Network. Chris is an athletic trainer in the physician's office setting with St. Luke's, and Dan is currently going through his athletic training residency there, which we'll learn more about as well. And so, fellas, great talk at ATSNJ 2022. I really want to get into some of the key takeaways from your presentation. The first one is, can you just give us a high-level overview of the various professional development pathways available for athletic trainers?
Yeah, sure. So there's several different post-professional pathways that you can take for any kind of avenue that you're looking to pursue in your career. I think it's really important that you sit down and really identify what your goals are for yourself in your career and what you want to achieve, and then basically taking the pathway that best suits you after you identify that. So the first thing you can do is continual professional development, which is something where we basically set goals and milestones and then obtain certain information or knowledge, skills, classes, conferences, labs, seminars, and whatever may be available to you or whatever fits your learning style best in order to meet some of your goals and objectives for your career. And then keeping track of that and understanding when you're meeting those objectives and then tracking your progress throughout your career.
So that's basically kind of what athletic trainers currently do the most part, but just being very organized about it, having specific goals to it.
Absolutely. So having a structured framework to it where you know that you're achieving the goals in a timely manner.
Great. Awesome.
So the next pathway will be your post-professional master's degrees. These are typically designed for development and enhancement of some kind of clinical skill or a specific area of focus that you might have. Typically, we've seen in the past that these post-professional master's degrees have been used for like transition to practice for new athletic trainers. And we've seen them paired with things like graduate assistantships before. But now we're going to start to see some of those post-professional master's degrees go away now that we're transitioning to a entry-level master's level for athletic training here. However, we can still utilize post-professional master's degrees with other degrees such as like a MHA or MBA or something that may fit your specific interest or content area in those regards. And then from there, you get into the DAT degree. So the DAT degree is going to be designed for clinicians in regards to advanced practice leadership. So this is not a transition to practice degree. This is for the practicing clinician who's looking to really enhance their skills and propel their career to the next level. So this is going to be individuals who want that extra push in terms of advanced practice leadership and those who want to continue practicing as a clinical athletic trainer. And then to contrast that, you can then get into the PhD pathway. And the PhD pathway is typically an avenue for people who want to be involved in academia in the profession and also with problem solving major issues within the profession as well. And the things you can learn with a PhD are like how to develop a curriculum, how to start an athletic training program, things of that nature. So the biggest kind of takeaway there is to understand the difference between a DAT and a PhD degree, knowing that a DAT degree is more focused on the clinical application of athletic training, whereas the PhD degree might be more of like a problem solving and developing a stewardship of the future of the profession. And then lastly, we have the residency pathway as well. And the residency pathway is really going to be focused on the development of clinical specialists through didactic and clinical content.
Great. And can you really dive in? First of all, thanks for clarifying between the difference between PhD and DAT. That was helpful. Let's dive into that residency a little bit. You're going through that personally. What's it like going through that? How do you feel that shaped your career over the last year or so? And what is your biggest call for why athletic trainers should consider that?
Yeah, so I think residency to me has been invaluable so far. I've had a lot of great experiences, and the biggest thing to kind of realize is the true definition of a residency is a combination of focused clinical and didactic experiences that are created and developed to create that clinical specialist. So it's going to be hyper-focused content within that specific content area. And there's 8 different content areas that are set forth by the CATI that your residency could be in. The one that I happen to partake in is orthopedics. So for me, I know all of my didactic and clinical content is focused specifically within that orthopedic realm. And I get that high level advanced education within that as well. And then also guided like mentored experiences and a bunch of clinical immersion experiences there as well.
That's awesome. Very exciting to hear that opportunity is becoming more and more available for athletic trainers around the country. And one of the things after that residency that you, from my understanding, can go then move into, Chris, if you could speak to this, that BOC specialty certification, not just potentially specializing in something through your residency, but there's other pathways as well to doing that.
Yeah, absolutely. So like I explained today in my presentation, there's two pathways to qualifying for that BOC certification. So the pathway one would be going through the residency and then having 2 years of experience. That 2 years can include that year of residency. But the other pathway, alternative pathway, which I think is important for a lot of those that may have been in physician practice for the last 10, 15 years, even 20 years, they didn't have the residencies then, at least at greater numbers and with accreditation. I think it invites them to the table. It doesn't exclude anybody, which I think is really important with getting the profession in general just behind this. And like I talked about today, I don't need to have the certification to do my job, but in order to push the profession in the right direction, staying conducive with the residencies and how they're following ACGME guidelines and being at the highest level possible, we really need that, set that standard. Just like any athletic trainer that gets the BOC certification to be an athletic trainer, that's just the beginning. You always want to continue to improve upon that. That's the bare minimum, and that's the nice thing about the residency and that alternative pathway. And it encourages people to continue to develop clinically, professionally, and then you'll have a certification to prove that. That way you can take that to your employer for increased marketability, and just doing the right thing. I think it's very helpful, but we have to get everybody behind it.
And in addition to the orthopedic specialty, which Dan is focusing on, and that you've mentioned, what are some of the other specialties real quick that you can focus on in that?
So right now, the BOC just has orthopedics, but I think there's a focus on trying to get primary care specialty certification down the road, but that'll come down with more residencies becoming accredited. So I think that's a driving factor, is we got to get some of these other residencies accredited kind of for these alternative areas like preventative medicine. I know at St. Luke's we have occupational health residency in its self-study year. So once that gets accredited, which I have no doubts it will, that'd be another pathway that BOC can consider. Okay, here's another specialty certification. We can kind of build upon that. But it really depends on what other specialties are going to be built out, and on top of that, there's going to be fellowships down the road too. So we have plans at St. Luke's to develop in fellowships down the road as well. It could be foot and ankle, could be shoulder, and there could be more certifications down the road as well.
Excellent. Thanks for expounding on that. And just kind of one key takeaway real quick, Chris, if you could mention at the end your talk today, you said about central messaging, about being clear with the messaging pertaining to these different pathways. What's your key takeaway for athletic trainers in that regard?
So my key takeaway is, like I said before, it's just the beginning. You always want to continue to improve upon where your stance is, and regardless of what pathway you choose. For me, it was the residency pathway. I wanted to be in the clinical setting, but that doesn't restrict me to changing any other direction. I can potentially get my MBA or MHA, whichever way I want to go. But just continuing to encourage athletic trainers to figure out where their focus area is, figure out where their passion is, and then improve upon that. And I think Dan did a great job of illustrating the alternative pathways to achieve those goals, whether they want to be in academia or kind of split time academia / residency, which I find to be pretty rewarding. So it's just continuing encouraging them to continue to improve themselves, whether that's just professionally or clinically.
Fantastic. Dan and Chris, really appreciate you taking some time. Great messaging, and thank you again for presenting this very important topic this year at ATSNJ 2022.
Thank
Great,
you so
thanks,
much for
Ryan.
having us.
Appreciate it.
Absolutely.